Okay, hello everybody. It's 3 o'clock, and so in interest of time, I think we'll get started. For those that don't know me, I'm Tracy Cannell. I'm one of the Joint Chief Executives for the GP Care Group. We should have some people joining us today from the Department of Health. I'm not sure if they're online yet. Ravi, Naina, Issy, are you there? And we should also have Polly from the London Borough Tower Hamlets Public Health. I'm not sure if Polly's on yet either. No. And silence. What we wanted to do was Ravi. Joining. Ravi, we're just starting. So you've just got time. Do you want to introduce yourself?
Sure. Hi, everyone. I'm Ravi Baines. I'm working at a national testing programme. And in particular, I've been focusing on the GP service model. So understanding what is the right way of meeting a particular group of patients or people in the community via GPs, and how do we make it right, not only for the patients, but for general practitioners and all the staff that work in general practice as well. Just as a bit of a heads up, my background is that I did my MBBS, so you can call me a sellout at any point you'd like, and I'm okay with that. I'm well aware if you think you're disappointed, my mother was far more disappointed. So there we are.
Thanks, Ravi. And we've also now got, I can see Polly's online as well, Polly Ashmore from Public Health. Polly, do you want to say hello?
Hi, everyone. Nice to be here. Do you want me to give a quick intro, or is that okay?
That would be brilliant if you say why you're here. That would be brilliant.
Sure, yeah. So I'm the Public Health Specialty Registrar at London Borough of Tower Hamlets, and managing the local contact tracing rollout. I say I'm managing, obviously that's actually GP Care Group, but on the local authority side, and liaising with Public Health England to work out what our model should be and what other local authorities are doing and lessons that are coming out from other local authorities.
Okay, so what we wanted to do this afternoon in the brief time we've got is update you all on what we've been working on to help with controlling COVID levels in Tower Hamlets. And some of you might recall that we in Tower Hamlets recognised that we've got some particular challenges for our population right at the very beginning. And we were campaigning quite hard to look at how could we in particular improve testing and tracing for our local population, given their particular needs. And I think if we look at the statistics this week, unfortunately we can see that Tower Hamlets is struggling. The positive rate within Tower Hamlets is one of the highest in London, and the level of testing has been one of the lowest. So we do have some particular challenges that we wanted to help support our population with. So what I'm going to do today, and I have plagiarised several slides that Ravi has produced, and I admit that readily, but try to localise them in terms of the model and what we're doing. I think, Ravi, that we're the first full borough looking at how can we support testing from a primary care perspective, which is really exciting. And want to talk you through how we're trying to approach that. So, and in particular, not to scare you and not to make and to reassure you that we're not expecting everybody who requires a test to come onto the phones or bang at your doors in each practice for a test. So I've got quite a lot of slides to go through. Could I ask if you've got some questions? I'll try and make sure I stop at various points. Ravi, Ruth in particular, and Polly, please interject. And if you've got any, put them in the chat as well. But if you could remain on mute, otherwise that would be brilliant. Okay, so I'll just upload the slide pack. There we are. Should be coming up beyond your screen in any moment. Can you see that?
Yep.
Yeah, great. So start off with testing. So thanks to Raghav Ravi and his team for being so supportive. What we've managed to do is to agree that from a primary care perspective, we can access swab tests within primary care, and the aim of it is to particularly look at those vulnerable patients that would struggle to access tests by the normal routes. What we don't want is for the general public to be going into primary care at this stage to access it. So we're not planning to advertise it. It is to supplement the PLT, so that's the public testing routes, to avoid that. To make it work and to roll it out quickly, we've managed to get an initial supply of test kits for every general practice, so that where you want to, you can undertake tests directly. And that might be where you've got patients that came to the practice that you didn't know they were symptomatic. They may be symptomatic when they arrive, and therefore you test them there and then. But equally, what we recognise is we don't want symptomatic patients wandering around the borough. So in particular, what we've put in place, given that you speak to so many people on the telephone, or you receive e-consults online, is a home visiting service which sits alongside the COVID home monitoring service that we've already got in place, which means on your behalf, if you send out an email referral to the monitoring team, they will go out and they will swab the patient for you. Just in terms of costs, the kits that you've received and the processing and the administration of them doesn't cost anything. That's provided by the Department of Health, and the care group will coordinate it and support it at no cost to you either. In terms of the initial registration, say to get it going, and some practices will have different views and ways in which they want to use this, and that's absolutely fine. But so that each practice has the option, we've identified a lead within each practice, which the CCG has helped us to do. You've each got your own number, which we can then use to monitor activity levels, to help Ravi with his pilot and look at what's going on across the country, and to order supplies if you want some more. So if you haven't received your test kits already, you should get an initial batch of 40. The home testing will be via email if you want that to do us for you. And if you do undertake a test on practice, obviously you need to think about where you're going to do it. But please note the bottom line, it's up to individual practices, and we try to be as flexible on this as we have been in terms of supporting with home monitoring.
If I can just quickly add to that, just from the point of view of this pilot and the national rollout, we are very clear that this is a voluntary service. We're not forcing this upon any GPs out there. So we are just making that very clear for everyone.
Thanks, Ravi. In terms of, just to make that clear and reiterate it, we'd normally expect patients to be tested via 119, and there has been an issue with test sites. A test site at Watney Market has been opened, and I was just looking at the stats which show that quite a large proportion of people now accessing tests within Tower Hamlets are using Watney Market, which is great. But Polly, there's also a plan to add a site at Mile End. I think, is it later this week?
I have to double check with Keith on the timelines. I haven't been able to get hold of him, but I can update the group later once I hear back.
I think he's hoping for Friday, and that's at the Arts Pavilion, I believe. So we will have a couple of sites which people can walk to make testing far easier through 119, which is brilliant. But then there are patients that might struggle, and you'll know probably who they are. and struggle to access a test successfully. So you've got further options, and I've put these in order of probably the routes which are less onerous for practices. So we can go to the home and swab a patient for you. And it's a very simple process. If you've been using the home monitoring service, you'll be familiar with that. And you can see those arrangements set out there. That's well established and has worked really well. So that's an option for you. Within the extended GP hubs and the Clinic One hub, you can also, if you feel that a patient does need a face-to-face for more reasons as well, and you can't do that in practice, then they can be swabbed there at the same time. And then the option is there in terms of GP practices as well, where you've got some tests for you so that you can do that. Shall I just stop at that point in terms of overview? Are there any questions before I move on?
I just come up in the chat which asked about why you need to keep an eye on the patient. So I think what we're trying to say is, we're not saying you have to observe them very closely. The way, and we will come on to it in a bit, is the way you register a patient, you need to know exactly what time they took the test. So the reason we ask you to observe the patient is more to make sure it stays within the control of the sphere of the HCA or the general practitioner who's given that test out. And I'll go into a bit more detail when we come to registering the test kits and why that is.
Yeah, I mean, it's probably worth saying, Ravi, as well, I'd asked also whether we could send the test out and observe it via video to avoid a clinician going out, but you were not very keen on that option, are you?
It's just the idea of keeping test kits within the control of the surgeries. And when we go through the service model, I'll explain exactly why we've set it up that way and why other reasons. So I'm happy to do that in a bit.
Thanks. So there's this slide pack is also the SOP, so I'm not going to go through it in all of its detail because that will take more than the time that we've got allotted, but we will send these out. What I didn't do is I just want to see what comments we got back, so how we make sure that these do give you exactly the information we need before we send them out. So I've already referred to that number and how that will be used, and to order more tests if that's what you want. We did look at should we coordinate the provision of tests to practices at a central level, but I felt that added to the logistics process and delayed potentially receiving the tests if you wanted them. So that was the reason. If you decide that you don't need all your tests that you've got, then we can look at how we use those in terms of the borough, and particularly as we're doing the home testing, how we pick those up on your behalf. There's some FAQs there, which just reiterate some of the arrangements that we've got, and again, that's a bit of detail. Ravi, if you think there's any points that are particularly worth picking up and focusing on, then please interrupt me. I'm more than happy that you do that.
Yeah, just to reiterate, the primary, we still want the primary source of testing to be the regional testing sites at home testing. If they're able to do that, that's the way they should go. That what we're trying to do here is capture those vulnerable groups, those groups who might otherwise not go to those testing sites for cultural, language barrier, computer literacy reasons. We're hoping you guys can help us capture those ones.
The unique organisation number, some information there. The test kits, if you've seen them, they're fairly familiar. They're the standard packs and that have been used. And then there's something that sets out how it will work out within Tower Hamlets. So we initially had a box of tests, then there are arrangements for testing, and then arrangements for how that's registered. There are options in terms of how you return that completed test, depending on the number of tests you have. Most of them, if they're less than 8, will be posted, and there are post boxes which are particular post boxes that need to be used, but we can tell you which post box is closest to your practice, And Ravi knows a village that I know really well, which is tiny, and it has 4 of these post boxes, and I think it's only got about 2 streets. So they are literally everywhere, or where we have got larger numbers of swabs happening a day, which is probably more likely centrally than they can be couriered. I think importantly that the results will go back to the patient and the GP, and if they're positive, they will also go into the national tracing system as well, won't they, Ravi?
That's right.
In terms of what will happen after that, when that test is positive, again, the GP will be informed, that, obviously, so that's helpful. But in terms of what you don't need to do anything in terms of that positive test and the contact tracing, that will be picked up automatically. Okay.
So a quick one on this end-to-end slide, just so everyone is aware, so that registration, there's quite a lot of information there. I know the one that sometimes causes a bit of what the hell is that, is occupation. That really helps our test and trace team. If you do have that information, it will also ask how recently they went into the office, if they did go into the office. There's an easy workaround where you just say, prefer not to say if you don't have that information. So it isn't actually a big blocker if you don't have that information to register the patient. The reason we ask GPs or the site to do that piece, and I'm sure we're going to go into a bit more detail, is that we've seen that's often a big blocker for people to get testing. They don't have that computer literacy, they don't understand English as a first language, so that's often why we ask that to be undertaken by the practices or the surgeries. And in terms of getting it back, the Royal Mail priority post boxes, I've once described them as rats in New York. They are everywhere. I'm trying to find a better way of describing it. You will find one very close to you no matter where you are, especially in London. That's been the preferred route by most sites because it gives you a lot more, what's the word I'm looking for? You're able to choose the time you drop them off, basically. Whereas the e-courier, it's a very set time. It's 9 AM to 1 PM. That is the perfect window they've given us, obviously really large and really helpful, but I'm afraid we can't make it any more smaller than that window at the moment. So often sites have preferred using the Royal Mail. The reason we say 8 is because there are some Royal Mail boxes that are a bit smaller. It's also being used for home testing. So what we're worried about is, you run out of space and you've got some kind of test kits hanging out of a post box, and the Guardian getting hold of that photo.
Okay, someone's just asked, because they have the slides, and yes, I said we will send the slides out. I just want to make sure that we picked up any issues from this webinar before we did. There's some standard information about carrying out the test there, which I won't go through in detail. The confirmation of the PPE requirements for you, in terms of the PPE that you should use. And then some information about the registration as well. And I've talked a bit through that. Say the routes for getting the test to the labs, it sets out a bit more information around those and the timescales for that. Say in terms of receiving the results, they're normally within 72 hours. And I think we need that, think about that safety netting and making sure the patient knows they should call 119 if they haven't had their test result. That might be something that we need to make sure that we build in a bit and highlight. In terms of Tower Hamlets and how we're supporting it, we're offering to coordinate it, so we're offering to provide the home swabbing service to keep the pressure off individual practices. Vicky, I think Vicky's on here, she can say hello perhaps. We'll be coordinating that for us. Vicky just joined us last week.
Hello, yes, I'm here. Hi Tracy, yeah. Hello everybody. I've met some of you so far already, but yes, I'm happy to help if you've got any queries.
And Vicky's going to contact you to make sure you've got your tests, the initial support's all right, go through the details of you, and then if you've got any problems on an ongoing basis, then contact us and we'll do what we can to help. at the end of it, Ruth and I have put together a pathway which just describes the different routes and how it will be managed, so it's hopefully helpful for you. This is for patients, and I think I should probably reiterate, it is for patients, it's not designed for staff, and it's to supplement patient methods. For staff, we've got staff testing via NEL, and that seems to be working quite well now. We did have some problems, but and if there are problems with that route, we're happy to continue to support you with that as well. Are there any, as an overview, is there anything anybody wants to add?
I was just going to add that on the link to the NEL's testing site is on here, but obviously unless you're looking at it electronically it won't work. So we're putting out another item in the bulletin again this week. It went out a couple of weeks ago with the information about how to access that for staff, because I know there's been a bit of challenge around that for practices and for services, but it is now, as Tracy said, working quite well. I've referred a couple of people and it's been quite simple to do, and they've been very timely.
And I see Joe's put in a chat, and we did put it there. It is in the slides. A reminder, the app, because of the way that.
One last quick one from me, just in terms of the pilot, we're calling it a pilot. We will continue to support you guys. This will be rolled out at some point in the near to mid future nationally. So you will nicely roll into the national rollout. You won't need to do any major changes on that side. What we might change is, instead of an email asking for more kits, there will be an online portal for you to ask for more kits, and you'll get updated information. But just because we're calling it a pilot, it doesn't mean it's going to go away. This is definitely going to roll out nationally in some shape or form, and we'll continue to support you after the pilot phase, so to speak. And
it's asked about staffs with associated services. Primary care staff, even the associated ones, are covered by that NEL route. I think there's probably worth saying, just to confirm, that if you're in practice and you access it via the GP internet, that's absolutely fine. That works. But for associated staff, they do need to go through the employer, and rather than through the practice internet. So it's a slightly different arrangement, isn't it, Ruth, for associated staff, which includes health advocates, social prescribers, etc.
If they follow that link, Anna, they can contact and get a login. So basically then they will be able to refer staff within their service.
And Mike, did you want to come on to talk about your question?
Do you mean the link NEL staff testing?
Yes.
And what about the role of contact tracers? I wasn't asking about how they got it. I was wondering about their role.
I'm going to come on to that, Anna, if I can. Mike Casey.
Yeah. Sorry, it's just I've already had one today about someone going for a colonoscopy next week, and they're having trouble with their test, and can we do it for them even though we don't have the kits? So I'm just a bit anxious that once the wider health community start realising that we have testing kits, that we start using them for not our own needs.
That's a really good point, Mike, and so let me take that away. So for any elective care, there should be an elective care service where the hospital is able to ask for a home kit for that patient, and they're on a prioritised pathway, which means they get a turnaround much quicker than usual. So let me take that away, and we will make it clear with our NHS colleagues to make it clear to secondary care providers and tertiary care that should not be happening. We've agreed this with BMA and RCGP as well, so we are in contact with them to make it clear what messaging, but I'll add that to our messaging.
I think we were absolutely clear about the focus of this pilot. From a central perspective, we can also talk to Barts Health about that, because I presume that's where most of them would emanate from. In terms of those arrangements. Again, though, I suppose equally centrally, if there are some vulnerable patients which was struggling that route, then we're happy to, and I'm sure that will be fine, to take those by exception, which again keeps them away from you at practice necessarily having to do it as well. Okay, are there any other questions on testing? That's a very rapid run through, I know, but I want to check whether there are any other questions at this stage. Hopefully it's fairly straightforward. It is about adding to our tools and certainly not changing the flow of where people would normally go, but it's trying to make sure we cover our population better, and hopefully we have a better service in Tower Hamlets as a result. And if we can keep the number of positives down, then that also helps keep activity levels down as well, I hope. What we want to do is keep this under review and make sure that we've got something that is supportive, does work, and so we'll be working with Ravi and the rest of the team around that to make sure that's working well, and Vicky will coordinate that. So any issues, any concerns or any suggestions about how we can improve it, please let us know. Okay. Anna, you've asked about the delay of results and about whether there's enough tests.
Yeah, I just thought, I mean, we've all in the news as well as in experience had these big delays, and it's great that we've got a bit of a way in sideways, but I wondered what it was realistic to expect at the moment, both through the Watney Market setup from identifying someone with COVID out to get the result out, and whether the speed will be similar for the people coming through this channel.
Yeah, I did have a good question, Ravi, on this when we started.
Yeah, so in terms of the number of test kits, there's a warehouse with 2 to 3 million test kits that's waiting to be sent out. So we have test kit wise, we're fine. So the channel that's supporting GPs supports our care homes with their regular testing. So in terms of number of test kits, we are more than stocked up now. As you are aware, it's the lab capacity is the issue at the moment. Lab capacity will continue to be an issue no matter how much further we are down national testing programme. However, what I can say is it's increasing. I know the teams that are working on it 24/7, it is increasing all the time, and we are seeing those numbers reducing in terms of turnaround times from you getting a test kit and for you getting a test result. So it's all moving in the right direction. That isn't to say it's perfect and that it's all sorted out. We are moving it in the right direction. We will continue to work to get it where it should be.
So what kind of time are we getting locally now from somebody reporting they've got it to a result?
It's a good question, Anna, and I can't say to yours. Yeah, I don't know the answer, I'm afraid, but I can always take that away and see if my MI team can find out.
People need to be updated regularly so it manages expectations, and also if people are self-isolating because of their uncertainty, it does help them to have some idea how long they'll know, it should take them to know.
Yeah, I very much agree, and what I can say is those numbers are coming down on a daily basis. I do know that much, but I don't know the exact number at most moment in time. So
if you do get the result, can you send it to the care group to circulate to us all?
I shall do.
Good.
Absolutely. So if there are no further questions at this stage on testing, I think we'll move on to tracing, if that's okay. Polly, you're there, so please, do you want to talk about the background of this and what we're aiming to do? I think I've summarised it on this slide. Talk to that would be brilliant.
Yeah, it looks like a great summary. So of course, as we know, NHS Test and Trace isn't getting to all cases. Previously, the average was they get to about 80% of cases. It's now actually gone down in the last week, so this is more urgent than ever. So that 20% of cases that they're not reaching obviously don't know what their result is. So across the country, local contact tracing teams are being set up. Quite a few local authorities have already started this, so we've got some helpful models to draw on. Within London, I think there's an aim for all local authorities to go live by end of October, early November. By the way, I think someone's not on mute and also maybe eating some loud crisps. If they could go on mute, that'd be great. Okay, thank you. Yeah, so sorry, I've kind of lost my train of thought. Yeah, the purpose of the local contact tracing teams is essentially to take those cases that NHS Test and Trace are not able to get through to in their first 48 hours of trying. So they try on the national number to get through to cases, and if they're failing, they send the case down to the local contact tracing team. In some local authorities, what happens then is it goes to another call centre and they just keep trying to phone the person. We're looking at a more enhanced model, so we'll start with a phone call. Peterborough, for example, said that this actually caught most cases because a lot of people responded to a local number, but were a bit suspicious of a national number calling them. But we've also got provision for door knocking and sending people out if we can't get to people through the phone lines. In terms of the staff groups we're going to be using and so on, Tracy, do you want to pick up on that operational detail?
Yeah, happy to. We planned a and proposed a model back in May, and I think some of you, including Anna, are involved in that. And what we're planning is that we use local staff that are used to working with our local communities, so includes social prescribers, but also our advocacy and interpreting team, given some of the language issues that we know that are part of the reason why people sometimes struggle. So the pilot that we are setting up is going to run initially for a couple of months to see how it goes. It will have a central point where it will monitor referrals into the service, which makes sense for us that it's linked through to what we're doing on home monitoring and now also primary care testing. For contact tracing, that will be operational 7 days a week between 8 and 8, and we are setting a standard that we aim to pick up cases and deal with them within 2 hours of receipt as a maximum. We have a bank of staff that we will fill a rota, which we'll use on a call-off basis, because one of the issues is we have no idea how many cases we're going to need to respond to, or how long that case is going to take. That could vary considerably. People have agreed to work on a rota basis to be available when and where needed, but we do want to make sure that we're using the most appropriate contact tracer, which takes account of the area that they're familiar with, the community that they know, and language, and also age as well, because we've also got some nursery nurses that we're planning to bring in, particularly where we're working with families, for example. The service will link to CTAS, which, if you don't know what CTAS is the Public Health England contact tracing system, so the national system. But we've managed, and apparently we're the first to work out how to use mobile devices, so staff will be able to work remotely and in supporting the service rather than having to sit in a central office, which will help make the allocation of cases more flexible. Initially, we'll contact people remotely if we can, but as Polly said, it could be followed up by door knocking where required. To make sure it's successful, we also want to link with our GP practices, our in-house services. For example, 0 to 19, who are also involved in outbreaks in schools anyway, and other community partners, to make sure that we working with finding contacts and working with them successfully. And then obviously there are a number of health and well-being issues that are related to these cases. Very often we want to make sure that we identify that and that we've got referral routes in place so that they can access support, whether that's food or funding or other support that they can. So we hope that that also helps support practices as well with the work that they're doing with their patients. There is a flowchart which is still in draft form that we've devised about, which we'll send you as well, so you can have a look at, so that you've got an understanding of what we're doing. of how we're going to work and how we're going to link with the national service. And we're still working out some of the techie details with Public Health England around that at the moment. So I think that's probably the summary. Anything you'd like to add, Polly?
I don't think so. Maybe just to reassure everyone on the call that the main focus of this is really understanding community and local assets as well as formalised services, and so using social prescribers, advocates and interpreters is really part of that. And we've had some really helpful feedback from local authorities rolling this out, that that conversation and supporting people through isolation is a big part of this, rather than just collecting up contacts. So at London Borough of Tower Hamlets, we've brought together a summary of what isolation support is around to support that, and we'll be bringing that all into the scripts in the next week or so.
Are there any questions on contact tracing? Any thoughts? No. Just in terms of the way that we're managing it, because I thought it might be helpful just to share our governance structure. We've got the COVID lead group and the core group that we have within the care group linked and primary care that will be overseeing both these streams of work. The silver test and trace is now changed literally this week, but it links back through to the Outbreak Health Protection Board at London Borough level. We've also though got a clinical reference group that we've formed for this work, which has got so we've got the operational delivery, but then the clinical reference group, which is going to have an overview at a Tower Hamlets level from our perspective of what we're doing within primary care to help us. Oh, I've got Department of Health down there. I shouldn't have that. Sorry, Ravi. And then with the membership of those groups and the clinical reference group is there. So Joe's on the call, is chairing that clinical reference group. Then we've got people involved on an operational basis over on the left. So those are our primary care groups and that will report through to the local authority and to Ravi in terms of the work that we're doing. So I hope that's helpful. I'll go back to the flowchart slide because it's probably the most interesting one. Are there any questions? Polly?
Just before we get questions, I just thought I'd flag, in case it didn't come up earlier, that we're doing an initial testing period of 2 months, and after the first month we'll do an evaluation report to see how the model works, how capacity and demand is looking, etc., and then think from that about the longer term picture over the next 6 to 8 months or however long this continues.
I think from our perspective, our ambition was to be broader and to be more locally based. So we want to look at how this is a step in the water and a step in the right direction in terms of what we're doing. But we'd like to look at what the right model of services that we support our residents and general practices with going forward as well. Any other questions and thoughts before we could finish early, which would be amazing. No. Anna, did you want to come back in? You're on mute at the moment, Anna.
It wasn't me having the crisps, even though I wasn't muted at that moment. I mean, I suppose one of my concerns would be that because I know that we all in Tower Hamlets wanted a very locally based service, and that wasn't what was given to us nationally, and at least we're moving in that direction now. But I suppose one of my concerns would be the people who are referred into the national service, I mean, who fall between the people who clearly aren't managing at all and the people who either feel bloody-minded or don't really understand what's going on, or there's all, I mean, so I'm wondering what your feeling is about how we can support the national service to be more effective if people are contacted by them, or are we stuck on that?
So I can take this one initially, you like, Tracy. Yeah, it's a conversation that's happening across the board. We have weekly meetings with PHE and across local authorities, and this is a big question of what about the 80%? Are they getting support as well about local services? I think the main focus at the moment is to get this set up so that we can do the minimum that's asked, which is picking up that 20% of cases, because of course that's the most urgent thing. But I think part of that review will be, you know, do we have capacity for more? What would more look like? And local authorities across the country, I think, are feeling similarly, and looking at what can be done locally versus nationally, and that will be an ongoing conversation with NHS Test and Trace. So for now, our focus is on those 20% of cases, but it's definitely an open conversation and one that we're not the only ones asking.
I know from public health you've been out to community faith forums and things like that. So what I was wondering is how much of that work is dealing with reaching out to get the various communities and parts of the community in Tower Hamlets more informed of what to expect and what they might be advised to do and so on. Are you using Bangla TV, for example, and Channel S? I'm just wondering how this is fitting into what people will already expect and have heard about.
Yeah, so there's a whole comms stream to do the infection prevention agenda and think about stopping it transmitting in the first place, helping settings think through what they do if there is an outbreak linked to them, and then also promoting test and trace. So our community navigators are giving a number of presentations about test and trace so people understand what will happen if they do order a test and how the process works. It's funny you mentioned radio and TV actually, because our comms team is looking into that this week, and we've also been making videos with some local communities. I think there's a video with an imam from the Somali community that's just been developed. So yeah, there's definitely a recognition that we need to work with where people receive their comms rather than just popping it on our website, and that fits into the whole spectrum of infection prevention, control, outbreak control, as well as test and trace.
I think helpfully as well, the Health Protection Board is focused now on, it's got 3 priorities and 3 groups that it's looking at, and one of those is people, isn't it, Polly, to make sure that we've got a real focus on that. So I think hopefully 2 exciting and, from our perspective, long overdue developments in terms of trying to make sure that we're being as effective as we can and doing what we can to help deal with COVID locally. I'm really excited, and thanks Polly and Ravi in particular for your support to Tower Hamlets and primary care for getting this off the ground at large. That's lovely, Anna. And it'll be interesting to see how we go and how we work together to make sure we've got the right support in place for Tower Hamlets. So thank you very much for everybody that's joined the call now. I'm really pleased to say we've got higher numbers on now than what we're on for the CCG merger, which is fantastic. It's obviously a lot more interesting, so well done everybody, and thank you for coming, and have a great afternoon. Thank you.